Good evening and welcome to Head to Toe with Dr. T. Thank you for watching us and thank you for reminding others to watch because we're talking about a very, very important topic today, human papillomavirus. Remember, we're dealing with health. And today I've got a very wonderful guest, someone who's a seasoned professional from the Department of Family Medicine, Dora Nginza Hospital. I'm going to take you through her profile highlights and then we get straight to the topic. We will be showing some lesions. Don't be scared because this is very, very crucial and very important for teenagers, youth, old and young people, anyone who is thinking of having sex or who is engaging in sex or who is associated with people who are actually engaging in sex. This is critical for the country. Doc, how are you?
Very well, thank you. Thank you for inviting me.
Thank you so much, Dr. Febi. Can you just give us highlights of your career, Dr. Febi Ajudwa? What are you about? Thank you for honoring our invite, by the way.
Thank you. I am a specialist family physician. I work with the Eastern Cape Department of Health at Dora Nginza Hospital Department of Family Medicine.
I even thought we were the head there. Thank you so much for the wonderful work that you're doing and also the academics that we're producing from the department. I was even wishing that it was still part-time where I can also do it because I'm actually doing family medicine at the end.
Pretty much, yes.
Pretty much, so thank you so much. Family medicine actually encompasses all departments, so it's very critical and crucial because you cover almost every other discipline in medicine. You are all-rounders.
Yes.
This topic of today, human papillomavirus, can you just tell an ordinary citizen what human papillomavirus, why is it a concern, why are we making so much noise about it? Just create awareness before we talk about how can we see someone who's got it.
Human papillomavirus, as the name portends, is a virus. It's a virus that can cause infection. There are various strains, over 200 strains of the virus. But what is of importance is the fact that some of the strains are known to be carcinogenic, to be oncogenic. That's what the word we use for describing it, oncogenic. And the particular strains would be the strains 16 and 18, about 12 strains, but the most notorious being those two strains, 16 and 18. And then we've also got some strains that are less they're not oncogenic, but they can cause what we all know as viral warts, lesions that can appear in the mouth, in the genital area, wherever you have. How is it transmitted? Skin-to-skin contact. And the thing that makes it that we are talking about it so much is it's oncogenic. It can cause these lesions. It is associated with some cancers that we know, not just the cervical cancer, but it's been discovered to be associated with penile cancer, anal cancer, oropharyngeal cancers as well. So if you are engaging in vaginal sex or anal sex or oral sex, then and you pick up any of these strains and you have risk factors that make you immune deficient to the point where you can have a persistent infection, you can have precursor changes in your cells in those areas that can become cancerous lesions later on, which is why we say we're talking about it and alerting people to it. So we talked about skin-to-skin contact being the main mode of transmission. So it doesn't have to be ejaculation during sex. Even skin-to-skin contact involving the genital area can cause.
So actually the virus can actually get across and infect the other person without anything spilling from one person to another. You may not see some of these things, but the doctor is emphasizing that anyone who's sexually active, that is why I was when I was inviting people, I said anyone who's sexually active, who is intending to be sexually active, who's associated with people who are sexually active, irrespective of your sexuality. You could be gay, you could be lesbian, you could be heterosexual, but we're talking to you. You could be adolescent, we're talking to you. This is very, very important because that is the target population in terms of preventive strategies. Thank you so much. And
further, we say that depending on the kind of strain that a person is infected with, we usually say it's good for this for people to have, once you're sexually active, go for screening often.
What does screening mean? Because people are scared to go to health centers. They think when we talk about screening, some people are even scared to do pap smears. We see a lot of boys when we're preparing for circumcision find that they've got warts, and then that tells a story. And girls are not actually infecting themselves; they get infected through mixing with boys. Just before you even go in, the strategy in prevention, we tend to focus more on girls. It's good that you're actually all inclusive.
Yes. So we're saying skin-to-skin contact, depending whoever your sexual partner is, depending on whatever your sexual orientation is.
Yes.
What we would also like to add is the fact that if you want, we're talking screening. Screening can be that you go to the screening kits that are available in the pharmacies, I understand, and you can actually administer it, self-administered screening kits for HPV. And you send it in, and when you do that, you check in to see if you've got any of these particularly oncogenic strains, or to see if you've got viral warts. Remember, we said that it is possible to have the infection and not even know that you have infection. So not everybody, no symptoms, nothing, because you might not have the viral warts. Remember, the strains that cause the warts, the warty lesions, are actually not the oncogenic strains.
Yes.
They're the 6 and 11 commonly. So the oncogenic strains don't necessarily cause any lesions that you can see. If a person has a lesion and you do a pap smear, you could incidentally discover, oh, this person also has human papillomavirus. That are oncogenic strains. And I think we will talk a bit more about it, but I'll let you ask the questions.
Yeah, definitely. Let's just take a break and then we'll be back. Human papillomavirus is what we're talking about. It's very, very crucial and very important that you invite even your neighbors to watch, because wherever there is sex, there are problems. Every thing that seems to be nice, there is a responsibility attached. That is why we're here. We'll be back. Welcome back to Head to Toe with Dr. T. We've got a very lovely guest, Dr. Febi Ajudwa, who is working at the Department of Family Medicine, which is Eastern Cape Department of Health, based at Doranginza Regional Hospital. Thank you so much for being with us. This is a very important topic. Take notes and actually create awareness wherever you are. Human papillomavirus, want you to know the name, HPV. And then the next thing is, there's been so many campaigns for people to actually take or sign consent for vaccination of primarily, especially in South Africa, of young girls. How does that help? Can you just explain to a parent how does a vaccine work to prevent infection with HPV, and then touch on condoms also?
So we talk prevention when we talk about any kind of infection. How do you prevent it? And the recommendation of the Department of Health, the National Department of Health in South Africa, is that if we can vaccinate young girls before they become sexually active and are likely to pick up the virus, that then we probably stand a good chance of preventing a number of people from having human papillomavirus infections. And what then do you prevent? When you prevent the human papillomavirus infection, the vaccines that we have are particularly good for the oncogenic strains. So what you are essentially preventing is that your child will not get the virus infection. And if your child doesn't get the virus infection, the chances of getting a cancerous lesion caused by the human papillomavirus is drastically reduced. So essentially, you're preventing the precursor lesions that eventually cause a cancer. Remember that we mentioned that a number of cancers can be caused by these viruses,
Yes.
including, I didn't mention, vulval cancers
Yeah.
and penile
Penile
cancers.
cancer. Penile cancer, cervical cancer, vulval cancer,
Anal,
anal
anal
cancer,
and
yes, anal
oropharyngeal.
cancer. Men having sex with men, also take note.
So pretty much that is what you are preventing when you allow your child to get that vaccine. What else do we say you are preventing? Remember, in any place, you have to look at what you have in your pocket and give what you can afford. So our South African National Department of Health can afford to get this vaccine to the girls in grade 4 at the age of 11 to 12 years. If you pick them up that early, hopefully you prevent them getting
Before they become sexually active.
they become sexually
But
active.
other countries, especially first and second world countries, they vaccinate boys and girls. Are we doing enough as a country in terms of actually defeating the transmission of the virus?
I think the logic behind giving it to the girls only is affordability.
Okay.
Is whether the government can afford what the government can afford to give at this point. Remembering that we have so many other programs that we're dealing and we're running simultaneously. So that is the logic behind giving it to only the girls. But the recommendation from the World Health Organization is that boys and girls between the ages of 9 to 14 should actually be getting the vaccine. Aside of that, one more point to make is that vaccines are not restricted to people who have never had sex.
Awesome.
If you screen and you have not got the HPV infection, you can get the vaccine as well. So even though the government is not giving it to you free, you can actually get it for yourself
You can buy it.
privately. You can buy it, you can go to your GP and get it, because anyone between the ages of what I've described to 45, if you are sexually active and you have
Up until
screened.
age 45, ladies and gentlemen, you can always go for your own human papillomavirus vaccination, privately or wherever you are, as long as you are sexually active and you have screened for human papillomavirus. And if you are negative, then get a shot so that the body memorizes it. You say the recommendation from the WHO is that boys and girls should get it, but because of affordability, we're only focusing on girls here. How many shots can we get? And actually, we're battling with parents in terms of giving consent. Also touch on them.
So I think for the most part, this is where I think we in the Department of Health probably could do a bit more by collaborating and not sitting in our silos between departments to collaborate with the Department of Education and probably educate our teachers in the schools to transmit the knowledge to the children who carry the knowledge home to their parents, that they say that this thing is supposed to prevent cancer. And I know that no mother will hear that the government is giving vaccines to prevent cervical cancer and will not want their child to have it. So I think it is education for the most part that is lacking.
And kids can actually be good. Once they grasp the concept, they can actually
take the information
wonders.
home and tell their parents. And parents then will go out of their way to find out, oh, my daughter said this. Is it indeed true? And if they get it, they get the information, the correct information, why not? Why would they not sign for the child to get the vaccines? So I think for the most part, that is what we should be saying out there. This vaccine essentially will prevent cancer. Even though we know it is not foolproof, but for the most part, in studies that have been done, where they observed almost a 30% drop in the rates of diagnosis, even within the first 2 decades of life in the cancers. But these were first world studies, so definitely very different from our population. Our population, remember, we also have a high preponderance of HIV, which is an immunodeficient condition.
In fact, we will touch on that because people with HIV together with HPV, that is definitely something we need to talk on that. But we're going to take a short break and then we'll be back shortly. We're talking human papillomavirus with Dr. Fabi Ajudo, the head of Department of Family Medicine at Dorang Nza Regional Hospital. Thank you for being with us and thank you for listening and sharing the information. We'll be back shortly to wrap it up. Welcome back to Head to Toe with Dr. T. Don't forget you can watch us live on DSTV channel 260 or Free Vision app wherever you are, in your car, in your couch, or wherever you are. We are very, very much live. We're talking health, usukela enhloko uyotsho elizwaneni. And today is about human papillomavirus. There are two key strains. Zimbini intsholongwane ezixhaphake kakhulu, number 16 no number 18, ezincamathelene kakhulu nezibangela umhlaza. Not only umhlaza wesibeleko, umhlaza wesibeleko, umhlaza wesikhepe esapha ngaphandle, umhlaza wempempe, uba khona nalapha emqaleni because abantu ngoku benza isex besebenzisa imilomo namalwimi. So akunqabanga ufumana igonorrhea, akunqabanga ufumana i-human papillomavirus nalapha emqaleni. Then izitreins ezilandelayo 6, 11, 16 and 18. Xa ujonga ne-vaccines ezi zenziwe ngezi-species zezintsholongwane ukuzama into yoba umzimba wakho ozimemorize xa uphinda udibana nayo ukwazi uhlanganisa msinyane. Doc, can you take us through a condom? Is a condom of any value in terms of preventing human papillomavirus infection sexually?
It reduces the risk. It is not foolproof. Remember we said skin-to-skin contact in the genital area. So covering a penis is not the only part of the genitalia where you might have the infection. So people need to be aware of that. The fact that you're using condoms reduces risk, but it is not foolproof. And that, I think, is all we need to say about that. In terms of oral sex, because we've spoken about all the genital area cancers, but people need to also be aware that oral sex can expose you to having warty lesions in the mouth, in the throat, and you would find people even developing what we call papillomas in the larynx. That can all be as a result of HPV infection. Also,
and that's why I always say doctors must be paid more because they're the ones who see all these things.
And then you need to know that that also increases the risk of oropharyngeal cancers. So that they're not the only things that will cause oropharyngeal cancers, but yes, a lot of patients with HPV infections could end up with oropharyngeal cancers as a result of oral sex. So that said, I don't know if you have any...
People with the warts, there's a tendency of these people to keep them. While maybe a single wart lesion, then this thing multiplies very quickly. Can you actually emphasize the lessons? What should we do when we pick up, I've got warts on my genitals, I've got warts on my pharynx, I've got warts wherever?
Warts wherever, because they can be plantar, they can be on the hand, they can be in the mouth, they can be in the genital area, not just in the genital area. When you discover the warty lesions, the first thing you should do is go see your doctor, because it is easy when they're very small to get rid of the warty lesion.
Yes.
Even if it grows up, it grows again. Remember, most people who are immunocompetent, they can flush HPV out of their system within 1 to 2 years. So that is important for them to know as well, that it is there. Don't sit with it and let it grow to such a huge mass that you have to go into hospital and have a special operation to get rid of the warty lesion. You can get rid of it from when it's a very small growth, a small bump on the skin that you can just use the podophyllin or imiquimod, I think, that you can use. And the people, they're very, well, while it's still early to get rid of the lesion, while it's still small. There are other means of doing, for those who have big lesions, we would still say, oftentimes the strains that cause those big lesions are not cancerous strains. They're not oncogenic strains. So we usually say, it is still not aesthetically nice to have a warty lesion. So even if it is big, you can still get rid of it. Go to your doctor. Go to your doctor and have somebody help you. It can be a special surgery, in-hospital cryotherapy, liquid nitrogen, a lot of different ways. Laser therapy in theater, it can be used to get rid of the lesions.
Can you touch on HIV and HPV? What's their relationship? And what should we do in the presence of those two?
HIV causes immune deficiency. And so because the patient is, especially the HIV positive patient, who is living with HIV and refuses to use antiretroviral therapy, then your immune system is deficient. And because your immune system is deficient, it is not strong enough to flush the HPV out of your system.
Okay.
So you end up with what we call a persistent HPV infection. And a persistent HPV infection, remember the way the viruses work. Viruses generally just go to the cell, they insert themselves into the cell, and they make the cell start producing
produce more viruses.
without control. The risk for an oncogenic strain causing a precancerous lesion that would eventually cause cancer is increased in the patient who is immune deficient. That is the HIV positive patient.
Awesome. So in the presence of immunodeficiency, actually HPV is made to flourish.
Yes.
And in the presence of HIV that is not taken care of, HPV is likely to show you flames. It's likely to show you flames because you are not actually doing good, you're actually fueling it. So those are terrible twins. HIV screening, HPV screening, pap smears. Can you talk to people who are closing now? Just your closing, what can people do regarding pap smears?
The government in South Africa affords every female 3 free pap smears,
Oh,
which is good, I think, considering that these cancerous lesions on the cervix take quite a long
Yeah, 10
while
years.
to become cancer. So if you get a screen at the age of 30, another at the age of 40, another at the age of 60, above 65, you really don't need to have that. However, for the HIV positive patient, it's a different story. Because the HPV flourishes,
yes.
causes precancerous lesions, and the precancerous lesions, because there is no immunocompetent, there's no immune monitoring that's adequate to control the infection, the person ends up with a persistent infection, causes a precancerous lesion that can develop to cancer very quickly. So such patients, we say, HIV positive patients who we say we want more frequent screening in them.
Yeah, in fact, we do it annually. We do it annually with all HIV positive people.
So if you're HIV,
irrespective of whether they're taking ARVs or not, but definitely those are terrible twins. We
Yes.
should make sure. But I'm very grateful that the department is offering free pap smears. We just need to encourage people, educate people, and make sure that they do utilize and consume those services. Unfortunately, the enemy is time. Dr. Judah, let me thank you so much for honoring us and also for doing what family medicine demands, educating the communities. Thank you for the wonderful job that you're doing, and thank you for producing more family practitioners. I hope this message gets across all people. Young girls, young boys, if you can afford HPV vaccine, please get it. And those that can get it from any clinic, please sign consent and get it before you get sexually active, because HPV is likely to cause a lot of problems. Sex inengxaki. That is why ufuneka uyiqale unezixhobo. Thank you so much for being with us. Head to toe with Dr. T. Follow us on all socials, Apile Communications, Bomakaba TV on all social networks. Thank you so much.